we're excited.
Ashley, do you want to kind of start with starting with the accident and kind of leading into going into his first surgery and taking him to the hospital?
Yeah, so I got the phone call from George and his son at about 2:11 in the afternoon, and they said that my dad was attacked by a bear, and they said he wasn't in good shape. And I was like, well, is he alive? Like, that's all that matters to me. You know, I could care less what he looks like. I just want him here. And they waited for the helicopters and stayed with me on the phone the whole time until they got there. And then they life flighted him to Bozeman. And I came from Livingston, and Caitlin flew in from California. And we've been on an adventure together, all three of us. Oh, no one else is there. I'm very awkward.
You're doing great. Caitlin, do you want to take it over and talk about?
Yeah, so I know that Kylene had said I'm kind of acting as his voice, which is hard to do because he's a silly jokester. So sometimes I edit out some of the things he says. I'm like, no, Dad. But I think he likes having me there about 70% of the time. The other 30%, I'm a little overbearing. But he did prepare a little thing that he said, so I'll just open with that. So from my dad, hello everyone. Thank you for joining us today. I'd like to open up this press conference with a huge thank you. Thank you for all of the support, all of the love, all of the prayers. The kindness shown by friends and strangers alike has been overwhelming. I truly feel blessed to be surrounded by such amazing people. I also want to say that first root beer float is going to taste so amazing. And soon I'm going to be a free-range chicken and won't be hooked up to anything. So that's from him. I flew from California, like my sister said. Didn't have any idea how bad it was going to be when we got here. And then that first morning in the ICU here at the University of Utah, we met Dr. Hillary McCrary, who gave us, honestly, like the most amazing news we could have heard, which was that he's going to be okay. And that was like just such a huge relief because we were like, he's missing his jaw. How in the world is he going to be okay after this? But through like the amazing, amazing work that they do, he's going to be able to live his life like normal here in a bit. So we're pretty amazed and lucky for that. Like they had said, I've been here for 5 weeks, helping throughout the recovery, and we've had some good ups and some little downs, but some of the ups that I'd love to share with people are that on day 3, after being attacked by a bear, he got up and walked, which to me, I was like, that's insane. You were just attacked by a bear. How are you walking? So that was a huge up for us. They let him do these things called oral swabs, where you put a swab in your mouth with water. And of course, being the silly, goofy guy that he is, he was like, well, if I can do it in water, could I dip it in other things and taste other things? So the doctors were pretty amazing in giving him permission to dip his little mouth swabs in different juices and sodas. So after 2 weeks of having his mouth stuck open and not being able to taste anything, he got to taste something for the first time, and that was an incredible moment. Now he calls them tasty swabs or tasty pops, and that's like always the first question after he comes out of surgery. He's like, can I have a tasty pop? Can I have a tasty swab? And then we're usually like, you have to wait a little bit. But that was a huge high too. And now the biggest high will be going home and getting to continue his recovery and everything at home, surrounded by all of the people that support and love him. And he'll miss waving to random people in the hallways here. But yeah, he's been racing people in the hallways too, and we're like, take it easy. But but we're excited for him to go home and get a little new scenery.
Great. Dr. McCrary, do you want to talk about Rudy's injuries and the surgeries he has received here at University of Utah Health?
Sure. So the ironic thing about this entire story is I get a call on Friday night from my co-resident. We both trained at the University of Utah, and we did otolaryngology, head and neck surgery residency here, and I get a call from her that she's been urgently called in to help with a grizzly bear attack. And obviously that's quite alarming, but to come from my co-resident who got to take care of Rudy and be a part of kind of stabilizing him. So she was the one that secured the tracheostomy tube, which is pretty standard for anyone that is undergone a very extensive trauma to the head and neck. And all that is just basically creating an airway through the neck. And so not long after they went, he was in Bozeman, he was transferred to the University of Utah. I don't know exactly what time he got there, probably was pretty late, early in the morning, however you look at it. And so, as she said, I came in on Saturday morning and I got to meet his sister and, start learning about Rudy. And the first thing that was so incredible to watch is just how enthusiastic Rudy was, even after being just attacked by a grizzly bear. He was very adamant that he was going to fight this thing and get through it. And at that point, he was still on a ventilator and had a chest tube and lots of lines everywhere. And so for someone to be so enthusiastic about his prognosis and outcome that early is like very heartwarming as a physician. So after that, we had to do a few kind of minor plating. The grizzly bear did attack his neck, which caused what I like to call larynx fractures, and the larynx basically supports all the critical structures of the neck. And so we had to plate his cricoid and thyroid, and those are just, again, structural support mechanisms in the neck. And then we also had to place a big external fixator to kind of stabilize his jaw, given that there was a large portion of his lower jaw that was missing. And this is his model that we were able to use during surgery, and that just kind of shows the very anterior portion of his jaw that was missing, so the very front of it. And then after that, we had to wait some time. So we did a virtual surgical planning session, which allowed us to create a custom plate that was used to reconstruct his jaw, and to also create, they're called cutting guides, so that we could customize a flap from his fibula bone, which is one of the bones in the lower leg. We commonly use this bone to reconstruct the mandible for oncologic or cancer purposes, but we also are trained in doing this for trauma purposes as well. And so this model is just showing the fibula bone that we were able to reconstruct in 3 segments to recreate the front part of his jaw, and then this is kind of a model of his own fibula and the cutting guide that we used to make those segments of bone. And really through this virtual surgical planning, we were able to customize everything so that surgery went as flawlessly as it possibly could, and we had the best outcome. And so we did that on the 28th, which he's 15 days out from surgery. And he not only had 1 free flap, and so a free flap is kind of a transplant to yourself. So you're taking, we in his case took a portion of his fibula bone and some of the skin with an artery and a vein and hooked that up to an artery and a vein in the neck. And then my partner, Dr. Richard Cannon, took what's called a radial forearm free flap. And that, again, is taking some of the soft tissue, the skin, and then transplanting that up to the head and neck. And that was used to reconstruct his lower lip, because the entire lower lip was essentially missing. And so he had 2 free flap surgeries that day. 1 is a lot for a patient, but 2 is kind of a double whammy. And so it was just a very long day for Rudy. But needless to say, and I'm not surprised at all, he's done amazingly well with his recovery. We've had a couple small hiccups. He's had to go to the OR a total of 3 times, But we're kind of in a position where he is primed and ready to go back to Montana and be with his dog Sully and not be at the Huntsman Cancer Hospital anymore. So yeah, that's kind of a timeline of taking care of him.
And can you talk about his continued care? He's going back to Montana, but he will also be coming back here to Utah.
Yeah, so as you can imagine, recovering after one of these surgeries is a long and arduous process, and he's already done amazing. He's up and walking and doing everything that we kind of expected. He does have a small wound under his chin that just is taking some time to heal, just kind of given the extensive nature and the amount of soft tissue that was missing from the accident. We, couldn't close all of it, so there's a small portion of that wound that is continuing to heal in. We are working on getting Rudy eating, and maybe if he's really lucky, we'll have a root beer float waiting for you in the room. We'll see. But this is a common problem after these surgeries that, you're creating basically a hole between the oral cavity, his mouth, and the neck. We have to let all of those things heal before we let patients start eating, and he's very close, and we're working on getting him eating. And then from there, it's really just small. He'll probably need some small optimization surgeries. He is, drooling occasionally, and that is something that we commonly see with patients that have lost their lower lip either from trauma or cancer. And so he'll probably need a few minor procedures after this, but really the bulk of his surgeries and all of the big stuff is done and over with, and we're just gonna get him back out there hunting and snowmobiling and doing whatever he likes, so yeah.
Great, thanks everyone. We're gonna open it up to questions now. We are just asking, the family is asking to not ask questions about the bear attack itself. Rudy wants to tell that story when he's able to talk, but they are open to answer any other questions that you have. And if you have any questions on Zoom, please put them in the chat and we'll ask those for you.
Yeah.
Hi, it's great to be here. This is so inspiring. I just want to ask you guys if there were ever moments of fear. I know there's been a lot of optimism, and Rudy has a great spirit about everything, but were there ever moments of fear, and kind of what kind of fear were you feeling just in the whole last 5-week process?
I mean, definitely. I think we can easily say that. I don't know for him. I'm sure for him too, but we'll have him write if he has felt it. But for me, I got the call from my sister, which I knew something was up because she always texts me before she calls me because I kind of have a wonky schedule, and she didn't text me, and I answered, and immediately she was crying on the phone, and I was like, oh boy, something's wrong. And I flew from California, and there wasn't a direct flight, so I didn't have service for parts of it. So I got little snippets from Ashley, he's still waiting for the helicopter. He's on the mountain. He's still waiting for the helicopter. And I'm like, he's been attacked by a bear, and is he alive? How's it going to be? What's the future going to look like? I don't know. And the people who were there with him said, yeah, it's really bad. He's still giving us thumbs up even in the moment, but they said it's bad. And so there was a lot of fear in the beginning, but he's very strong. So we knew he'd fight no matter what, but we just didn't know how much of a fight it was going to be in the beginning.
I wanted to ask too for the surgeon.
Yes.
What's the first for you, seeing a story like this and surgery like this?
Yeah, so it is my personal first grizzly bear attack. My partner, Richard Cannon, trained in Washington, and at the University of Washington, they commonly get patients flown in from Alaska or various places, not commonly, but they could have patients flown in for, animal attacks. Grizzly bear attacks is new for me. I talked to my chairman, Dr. Jason Hunt, and said he's taken care of one other patient that had a grizzly bear attack, but that was several years ago, and truthfully, this specific injury was new to me, but what I will say is that his injury pattern is something that we commonly take care of And what I mean by injury pattern is like the defect that was created is something that we would commonly see for a lot of our head and neck cancer patients. And so the reconstruction is very similar in your methodology and planning. But yes, this is a first.
He said that his biggest fear has been that he's going to choke on his own blood and spit, so that scares him a little bit.
I have two questions, and maybe I'll ask the first and have time for
That sounds perfect.
My question would be, what has kept you motivated? I hear your daughter talking about how silly and positive things, but what is it that has kept you motivated through this 5-week recovery? And for you, doctor, can you describe the jaw reconstruction surgery in terms of how long that surgery takes and the stress and the wear it puts on a patient during that time? Because I can imagine that is an easy surgery to come through and to heal from.
Yeah, I'll let.
So while he's writing, if you'll answer.
Oh, yeah, for sure. So I will say the preoperative planning is like the most time-consuming part of this. We have to meet with an engineer who then takes his CT images, so his X-ray images that are then created into a 3D model, and then we basically have to create everything customized for him. So that's kind of the more lengthy process, is planning for the surgery. But then the actual surgery itself, so his surgery started at 7:30 and we got done at around 5:30 p.m. I also would like to note he actually got same-day dental implants too, which is, they call it like a jaw in a day kind of procedure. So we're reconstructing his mandible and giving him the option of having teeth as well. And so we were quite pleased with the efficiency of the surgery. And, while Rudy is asleep under general anesthetic, certainly waking up from that surgery is, it's very difficult for patients. And I think that it usually takes people a few days to kind of get back to their normal self somewhat. Just the length of anesthesia and the demand it puts on their body is extensive. So, and Rudy was in the upper echelon of excellence in terms of performance after surgery. But it is quite arduous, and, he did amazing, but it is a lengthy procedure. Yeah.
So, if you could read it, he said that the things that give him hope and have given him motivation to get through this are his family and life. He said, my job proves that most people are good and I can't wait to get back to it. And he also says, I will win round 2. I would like for him to not do that, please. But, yeah.
Go ahead.
And his prognosis, will he be able to function normally in a sense, after having that in a normal way, right? Will he be able to live a normal life with that reconstruction?
100%. He's going to go back and do whatever he wants in the backcountry of Montana and hang out with his grandkids. And he's already proven that he's able to get up and moving. And, while we're still working on getting him eating and getting his voice back, those things will come with time. And yes, he's going to make a full recovery and be back to himself.
Today is pretty huge. From I don't know, I want to say maybe day 3, he was like, I want to be on the news. I want to do a press conference. And we were like, Dad, can we just heal? So the fact that we've healed enough to get to today is pretty remarkable. And I know that he's super happy and to be here and to see everybody and to be thanking everybody. I know that this is a big moment for him. Do you want to say anything, Ashley?
I'm just happy he gets to come home soon.
Yeah, that as well.
And, be closer and, get to do the things that he loves to do. Eventually, not quite yet, but we're working towards it. And, yeah, it's good. It's a good feeling today. It's a good day, huh?
Kind of following up on that, why was it important to share your story? Why was it important for him to share the story? And thank you for sharing the story with us. It's definitely, I mean, it's true. People loved like hearing the updates, and it's just been inspiring to hear a survival. But just can you talk about like why it was important to share?
While Rudy's answering that question, we have some questions coming in on Zoom. One person wants to know when he's officially heading home.
That is a good question. Yeah, it's kind of a silly fun thing. Dad actually served in the Navy, so he has VA insurance, which, if you know anything about VA insurance, it can sometimes be a little bit tricky. So we're just kind of waiting on some of those things to go home, kind of more paperwork things. Physically, mentally, he's ready to go home, just more clerical paperwork things till he goes home. Yes, exactly. Yeah, we were hoping today, but it's looking like maybe Monday. So, yeah.
How long did the surgery actually take? Did it end up being 12 hours? It was about 10 hours, which was shorter than we anticipated.
Better than anticipated.
Yeah.
We have another question for you, Dr. McCrary. Around when should Rudy be able to speak again?
That is an excellent question. I knew that was coming. It's a difficult question. So we know that Rudy's vocal folds that allow him to breathe and talk work just fine. However, he had extensive trauma to this area, plus the free flap reconstruction. It's all new anatomy for him. And so some of these things are just going to take time. We have our patients work with speech therapists who are wonderful in optimizing patients' ability to speak after these types of surgeries. Rudy is able to vocalize, when he really tries or wants to say something, he is able to vocalize, and so we know he's getting there. I don't have an exact timeline, but I promise you he will be speaking before you know it.
Yeah. Do you want to say anything? Do you want to try to say anything? Are you okay? As he's writing.
We'll let him speak.
Yeah, it does hurt a little bit when you try to speak.
Oh.
A little, yeah. His left vocal cord, I think, is what hurts him, where a little bit of the damage was. So he said, to the question earlier that said, what made you want to share your story? He says, only by the hands of God am I here. I've had a lot of inspirations, and I felt the need to share my story with others. And believe it or not, I believe that this attack was an answer to my prayers, and that potentially it could help somebody else going through something similar.
We have another question coming on Zoom. Is Rudy still planning on doing the same activities and going to the same places, such as where the attack happened? And Rudy, if so, are you afraid to go back out and do those things?
So the answer, as you could tell by head nods and shakes, is yes, he plans on going there, and no, he is not afraid to go back out there. But I would like him to retire, but I guess the question wasn't for me. This isn't his first bear encounter. Basically, the trail where he was attacked, he's been going up that same trail for the last 20 years. And his first encounter with a bear was actually when he was 10. So he's not deterred by this, I guess.
Can you read what Rudy wrote
Yeah,
on
he
the
said
whiteboard?
my first bear encounter was when I was 10.
Okay,
Yeah.
thank you. Another question, has Rudy faced any injuries or obstacles before while hunting or doing any other outdoor activities?
I know our marker's running out of ink. We should have brought backups. I guess not ink. It's drying now. Yeah, I know he's writing. I can predict it now. He has a bad left knee from a previous bear encounter, but otherwise he's very healthy. No other anything, but yeah, from one of his previous bear encounters from running, he has a bad left knee. But
Go ahead.
You can answer this, but what is really the first thing he plans to do when he gets back to Montana? What is that one thing he
That's a
is
good question,
motivating him when he gets
to get back home.
Yeah.
You'll have to buy the book for that story.
That was for that's for previous, for the previous.
So, yeah, what's the first thing, or what do you want to do when you get back?
Oh.
His puppy. So
Yeah, so he has a little Yorkie that's been waiting at his fence for him every single day to come home. So he's very excited to see his little dog again. And I know that reunion's going to be pretty adorable too, because the dog is going to go crazy. Little Sully will go crazy. So very much looking forward to that. I think he's also looking forward to sleeping in his own bed too. And now, we've been watching Montana State football here. He's a huge Montana State fan, but he's really looking forward to maybe even physically going to the Cat versus Grizz game. And he's developed a whole new hatred towards the University of Montana Grizzlies. We don't like them at all. yeah. Oh yeah, not a hatred towards you.
No.
What does he have to be careful with moving forward? What, in terms of healing, what do you have to look out for and pay attention to?
Yeah, so at this stage in the game, things that we'd be most worried about are infection. He's kind of overcome the biggest, immediate post-operative complications. Like, we always worry that with these free flaps that the whole thing could fail, and both of them have done miraculously well. So he's proven that they're going to be just fine, and we're out of that window where we worry about that. But kind of at this stage, it would be infection and, ensuring that we can safely feed him without causing an infection. But in terms of his we took the graft from his fibula site. He's really not got a lot of restrictions from my perspective. He has some minor wound care to his forearm, but really biggest thing we're watching out for is infection, which he's not shown signs of. So.
Did you learn, is there anything you take from this surgery, from his case, that you will take with you in the future?
Yeah, I mean, being completely transparent, I've only been at the University of Utah for 2 months, and so he's very, very memorable to me. No, I just think listening to your patient, having the goals of getting your patient back out to the things that they love to do has been very motivating for me. But yeah, he's definitely one that I will never forget, for sure.
We'll never forget you either.
Do you have any advice for outdoorsy folk that might be worried about getting attacked?
I know what he's going to say.
Carry 2 guns.
Should I guess? Yeah, that's exactly what. Have a second gun. That is hard. I think the thing that truly helped is having people with you too. But so he's saying there's a lot of different scenarios when it comes to bears. Usually you'll hear or smell them first. Generally they run away. You usually can scare them too. But he was prepared. He's gone up that trail multiple times. He had bear spray. He had a gun. He just didn't have time. Yeah, he's seen bears 4 out of the last 5 years when he's gone up. So it's pretty frequent now. But I do think having people with him is truly part of the reason that saved him. Because he didn't have time for the bear spray or anything else. So having people there with you, being in a group, I think is a good takeaway. Who knows what would have happened? If they weren't there, is that what you're saying? Yeah. Yeah, he said on the same exact trail that they were on, there was 4 older than him hikers on the trail too. So he said he actually was glad that it was him and not somebody else, but because who knows what would have happened. But
Rudy, any long-term goals except for being on Survivor in the future? Is there anything that he's told you guys that he wants to do?
he does want to write a book, so be on the lookout for a book, or if you know a good author, because we're not authors, but he definitely wants to write a book about the whole story and everything. He would like Colt Hauser from Yellowstone to play him in a movie, so if we're really shooting for it. I've never seen Yellowstone, so I thought, well, I gotta see it now.
He's not bad looking.
Yeah. Yeah.
We filmed a lot of it here.
Did they? Really? Oh, that's so interesting.
Great. Any other questions?
Thank you.
Great. We're going to wrap it up. Thank you all. And it's been great to know you guys. And thank you, Dr. McCrary, for being here. We appreciate you.
We do.
Okay.
That Dad wrote a smidgen of a, do you want me to read this? Closing. I just want to end this by saying most of the important things in the world have been accomplished by people who have kept on trying when there seemed to be no hope at all. Even if there seems to be no hope, keep on fighting. Thank you. Thank you, everybody. Just those two. Just those two. Yes. Yes. Just today. That was a pretty cute, emotional reunion, too.
It was so cute. Ugh, they were so happy to see
He said, I love you. And they're like, Papa can talk.
me. Like, not quite.
It was pretty cute, though. Thank you so much. Thank you.
Thank you.